Now we continue our series on coronavirus lessons. This is lesson number 7. And this lesson is about the other pandemic, the mental health pandemic. We've been focusing on the health aspect of coronavirus in terms of the people who are getting inflicted by the disease. Now, the psychological component has been understated. The mental health component, which many people believe is even worse, and it's getting much worse because even after the virus has been contained with respect to the impact of the vaccination, we're going to see something totally different. Now, in any survey in almost every society, we're finding that many people are anxious, worried, sleep deprived, distracted, depressed, distressed as a result of COVID. Now, this happens for a number of reasons. The threat of the infection, the disruption to the daily life, and the uncertainty about future. Again, we've talked about people losing jobs, not sure what industries are going to come back and what is going to happen later on, so that very few people have any basis on having rational, optimistic view about things getting better. As the pandemic rages, this process becomes worse. And the long-term outlook for psychological effects are showing us that we are in line for some serious troubles. Will the pandemic change things? Yes, it will. And yes, it has. A lot of people have not spent any time talking about the psychological aspect of it. And we're seeing survey after survey indicating minimum of 50% of persons in almost every society are saying that, listen, I am impacted. Experts are beginning to sound the alarm about what is called the tsunami of psychological maladies that would really outstrip our mental health capabilities of coping with it. And especially in societies such as ours, which the coping aspect is limited. Now, what are we talking about? Let's take first, for example, the people who are involved in frontline action, the medical and other so-related entities. They have it from both ends. Many of them are living day by day with the fear of going to work, becoming infected, and ultimately dying. They get home to another set of stresses. Fear that I may carry this home to my loved one and families. So it's an ongoing, constant bombardment of the problems. So anxiety and fear is only so much you can cope for a period of time. And the result is that a lot of people are not doing well. A lot of people are suffering. Poll after poll is showing us that the adults are suffering. The children, even worse, because they too sometimes don't express it verbally, but in terms of their behavior, the regression taking place in their behavior, going back to when they were younger, is also part of the process. When you look at the impact of the social distancing, how we have to cope differently with persons, it's taken its toll on many people. The public health measures have largely been focused on the prevention of contracting the disease, but the psychological has not been dealt with. Now, what are we talking about? What are some of these issues that we need to? What are some of the symptoms that you may see in yourself and others around you? Feeling irritated on an ongoing basis. Feeling that danger is ahead, something's about to happen to you. Feeling uncertain, nervous, anxious, demotivated, tired, overwhelmed, burnt out. I can't cope anymore. Ongoing feeling of sadness, depression, trouble sleeping, trouble concentrating. That's at the individual level. What about when you look at the work-related level? Huh? Constant concern about the risk of being exposed at work. You have some control, much more control in terms of your home environment. What about if your work environment put you in closer proximity to other team members and, worst of all, the public? Constant stressors. Taking care of your personal and family needs while working, because am I doing enough? Is this putting me and my family at risk? Overload at work, because there's so many places the numbers have been cut, numbers are short, more work to be done, lack of access to the tools and the equipment you need to perform your job. In many places don't have all the things that they would need because of, you can't get them because of the supply chain problems. Feeling that you are not contributing enough to work. Feeling guilty about how you're contributing at work given the situation. Uncertain about the future of your job, the future of your company, the future of your business. Learning new tools of communication. We now have a thing called Zoom fatigue. I recently saw one group of companies have banned Zoom meetings on Fridays. Say that is only so much that people can cope with between Monday and Thursday. Let's do another way. Different ways of getting things done at work as a result of social distancing. Lot of stressors. So we can summarize these things, in terms of all of the areas that are impacted. They're all having to do with stress. More things demanded of you in a short period of time and inability to cope. One of my big concerns is the whole thing of post-traumatic stress disorder. The data is even showing that people who have been impacted by COVID, even after they're better physically, there's a long haul syndrome where they're still experiencing some of the symptoms. And anything that's associated with the disease takes them back to where they were before. Now, this can go on for a long time. And what we know about post-traumatic stress disorder is that the data is now showing that about 30% of persons who have actually recovered from COVID are experiencing symptoms of post-traumatic stress. This is quite debilitating. People are re-experiencing the trauma associated with the distress, flashback, the nightmares associated with what they actually experience. How does this impact their life? Many times, they don't want to go certain places. They avoid certain places, certain people, anything that reminds them of the things associated with COVID. Limiting their movement. Increased arousal, again, problems falling asleep, problems concentrating because the ongoing fear that this is going to happen again. Constant experience of negative emotions, which they tie back to what happened when they were not well. We can add now ongoing feelings of depression and anxiety. Fatigue, traumatic grief, burnout, because it's only so much that you can cope with over a period of time. Now, one of the ways this has manifested itself, folks, when we look at this mental health issue, pandemic fatigue sets in. Pandemic fatigue is real. And guess what? It leads to frustration. We also know that frustration oftentimes triggers aggression. Verbal aggression, physical aggression. No wonder in some societies we're seeing a significant increase in the crime rate, significant increase in the murder rate, because some disputes which have been settled with an argument, now it requires some kind of terminal solution. So this too is the result of the process when you experience this ongoing pandemic fatigue. Persons are feeling this and expressing this. Alcohol consumption increases, other kind of substance abuse increases. People feel that they aren't able to cope. Being impatient with those around you because it is not working for you. Now, what can we do in the short run? I recommend a number of steps. And one, I want to adopt it from what we do with our computers. When your computer is not functioning the way it should, do you keep just pressing the key? Do you keep just pressing the mouse? More often than not, we're told to us, turn off the computer. Restart. How about if we start that? And we start from that with ourselves. Huh? So I want to say step one, in terms of really dealing with your own mental health. Step one, have a do nothing day. What does that sound? At least one day a week, try your best to get that. Even one day a week where you will do nothing. And the way I like to say this, after you do nothing, then you rest. Give yourself a chance to recenter. Use that day to whatever things you enjoy doing. Stay away from the things that you don't enjoy. So whether it's a walk in the park, properly social distance, stay home listening to some music, chatting with friends in a socially safe manner, but all the stresses of your life, one day in which you do nothing associated with them. Step two, get regular physical exercise. There's no way around this, folks. We need this. The exercise triggers the endorphins. It makes you feel good. I like to remind people that so much of what COVID does, impacts the lungs. The only way to strengthen your lungs and your heart is via exercise. No medicine can do this for you. So an exercise program. I can tell you, I have upped my exercise program. Prior to COVID, I normally do about, on the average, 3 to 5Ks per week. Now I'm doing 10Ks. And I add to this weight training. I've stopped going to the gym about a year ago, but I've bought some weights in my home and I use this to stay fit. As a result, at the beginning I was at 230, then I'm now down to 208. So that I've made it my duty to get fitter, get stronger. Step 3, you need an energizing morning routine, something to get your day started. Consistent and energizing. What works for you? My day starts somewhere between 4 and 5 o'clock because I need to start with a meditation. Strongly encourage you to do that. Then I brew 1 cup of coffee. Meditation, coffee, and then exercise. So that first hour to 2 hours of my day is for me. I use that to get my day started in an easy, structured manner. There's a Zen saying that, if you, on your regular day, you should meditate for at least 20 minutes a day. But if you have a busy day, then you need to meditate for 1 hour. Paradoxical, yes. But the more stress you're experiencing is the more meditation you need. And by the way, in another series, we do a whole instructive video on what meditation is about and how to facilitate it. So you can just check online in terms of the videos that I post. Step 4, you now need a relaxing evening routine. Something to gently take the plane down, get you down from that hectic and stressful day. My routine is quite simple. It starts with a shower, because that's how I start to signal my body that now we're going into another zone. And then followed by meditation. Again, to close off the day. I do not involve things like listening to the news, watching the news, because that too is part of the stressor. Because so much of the news is telling us about all the bad things that has happened. So wean yourself off the news, especially the television news. If it's important, you'll hear about it. Huh? I read things on Twitter. I read the newspaper online. I see what the headline says. I get a feeling of what is happening, but I don't need the gory details. So I'm suggesting that you need a routine to end your day gently. But part of that end, turn off the news and turn on the music. And you want to select the kind of music that motivates you, uplifts you, relaxes you, centers you. Next step. It's important for you to be smart enough to know when to ask for help and where to get it. So if something is not happening, if it's not working, and there's a saying Jamaicans use, water more than flour, you feel that you're reaching your breaking point, ask for help, because this is very, very important. And as you go about that life that you're trying to keep centered, remember that social distancing doesn't mean social isolation. So use the socially safe method to keep in contact. You call a friend at least once a day. How you doing? How you doing? Reach out. Touch somebody else. Make their day a little more pleasant. Huh? The final step in this process is to celebrate, folks. Every single day we go through this above ground, celebrate. Plan ahead what your celebrations will be. Celebrate the small things. Any little thing, you'll find an excuse to celebrate because you need it. Too many bad things are happening. My most powerful celebration that I've come up with is what I call my fine dining Friday routine. For the last 4 or 5 months of the pandemic, every Friday in my household, we have fine dining Friday. What does that mean? Yes, we have the plates already. We have the good plates, all right? Take them out. We have good clothes, don't we? Take them out. Your good clothes are wondering if you're dead. They haven't seen you all this long time. Take out your good clothes. Get dressed. It doesn't matter what you're having for dinner. It could be the most basic dinner. It doesn't matter what it is. But I encourage you, get a bottle of wine. Because the wine provides that connectedness, and you have a fine dining Friday. I have been doing this for the last 5 months, and believe me, it works. It helps me to look forward to another week, and the fine dining experience takes me right through the weekend, prepare me for the next week. In terms of this mental health process, I want you to also start preparing in your mind and body for life after COVID. Yes, this too shall pass. Life after COVID. What do you expect to be? What do you anticipate your body of work to be? What do you expect your workplace, your area to be like? You start online learning. You start some way of reading and looking what is likely to happen to your area. What new skills are you going to need? You start acquiring them now as part of the process that you're going through. As you read, you learn all those other skills, all the things that you've always wanted to do but keep putting them off. Now's your time to start. Look at the projections. I can tell you one for sure. Anybody who can work anywhere from anywhere, gone clear. So if you need to start, prepare yourself to do that. What can you do to make yourself even that much more marketable? Yes, the good book, the wisdom tradition didn't say it came to stay, and it came to pass. This too shall pass. So, straighten yourself, look out for your family and friends. Those at work, see how you can strengthen each other. Stay grateful and celebrate. Because we do anticipate that this mental health pandemic is going to last even longer than virus pandemic. But we can cope with it. We can make sure we overcome. Share this video with other friends and family, anyone else. Like, particulars about it, so that we can send you more. Subscribe so that the rest of the series you'll be alerted. Thanks for watching.